So good morning. 364 days ago, this team stood here and laid out how Massachusetts was going to reopen the economy one step at a time. It was a major step forward after several long months of despair. Back then, effective vaccines were just an idea. About 7 months after that, when the vaccine became a reality in December, we laid out how Massachusetts would vaccinate 4.1 million people by the spring. Today, Massachusetts leads the nation in vaccinations, and we're on track to meet the goal that we set for ourselves back in December. Over 3.2 million people in Massachusetts are fully vaccinated, and over 4 million people, 75% of all adults, have received at least one dose of the vaccine. Virtually all of our residents who get a first dose return for their second, which is why we're confident that our goal of vaccinating 4.1 million people here in the Commonwealth will be achieved in early June. We've said since day one that we'll get through this together because the people of Massachusetts are strong, kind, and willing to sacrifice to help their neighbor. Today, more than ever, we know that's the truth. Massachusetts is effectively battling back in its campaign against the virus. Nearly every student in the state is back in the classroom, and we've reopened nearly every industry. We're safer, smarter, and better equipped in this fight than at any time since it began. And thanks to all your work, we're willing to take the next step forward together. Effective May 29th, the Commonwealth of Massachusetts will lift all industry COVID restrictions and capacity limits. Massachusetts is on track to reach its goal of vaccinating 4.1 million residents by early June, and this level of protection makes this step possible for the people of the Commonwealth. The science shows that vaccinated people are well protected against the virus and unlikely to spread COVID. Effective May 29th, the face covering order will also be rescinded and will be replaced by the Center for Disease Control and Prevention's new guidance for vaccinated and unvaccinated people. At that time, the Department of Public Health will issue a public health advisory urging all unvaccinated residents to wear face coverings in most indoor settings. The department will advise all vaccinated residents that it's safe to go back to doing the things we all used to do before this pandemic, consistent with the CDC's new guidance. The Department of Public Health will also be issuing a new public health order that will mandate the use of face coverings by everyone, whether vaccinated or unvaccinated, in a small number of specific places, such as nursing homes, healthcare settings, public transportation, and in schools. Again, consistent with CDC's guidance. We'll also end the current state of emergency on June 15th. We have a lot of work to do between now and the end of the month, transitioning out of the current state of affairs. But none of that work is more important than carrying out Massachusetts' national leading vaccination effort. We'll continue knocking on doors, making calls, setting up pop-up sites, and doing everything we can to expand access to vaccines. We're working day and night to reach everyone where they are, and we know this is more important and harder to do in our hardest hit cities and towns. There's no question we've made tremendous progress. Everyone who works, lives, or studies in Massachusetts has been or will be offered a vaccine at a time and place that is convenient for them. There's no cost and no insurance or ID required. If you've not yet gotten vaccinated, please get vaccinated to protect yourself and your family. As we transition away from the current restrictions, businesses may choose to set their own requirements for vaccinations or masking. We encourage them to do whatever works for them, for their employees, and for their customers. And we also encourage everyone to be respectful and to follow those requirements if a private organization puts them in place. We got this far because the people of Massachusetts followed the public health guidance to keep everybody safe, and we must continue to do our part to respect any rules and requirements that individual businesses or employers may choose to put in place. The temporary limits and restrictions imposed on the private sector and on individuals were the most difficult decisions I've ever had to make. The loss and the isolation so many of our friends and families experienced is likely to impact all of us for a very long time. The Commonwealth was tested. Employers, small businesses, hospitals, healthcare workers, and first responders were pushed to the edge. But together, we all fought back, made changes as the facts on the ground changed, and never, ever stopped moving forward. We all know this virus will be with us after any rule or regulation expires. But thankfully, the knowledge of our medical community is far greater than it was before with respect to how to treat COVID, combined with the results of our highly successful vaccination effort, allows us to get back to living our lives. And none of this would have been possible without the safe and effective vaccines that are widely available in over 975 locations across Massachusetts. And none of this would have been possible without everyone who calls Massachusetts home stepping up and doing their job. We lead the nation in vaccination rates, but until you are fully vaccinated, we're strongly advising you to continue to wear masks, wash your hands frequently, and keep your distance. The recent medical studies have informed the new CDC guidance and makes clear that vaccinated individuals are thoroughly protected from illness and very highly unlikely to transmit the virus at all. And Massachusetts is getting vaccinated faster than virtually every other state in the country. We've gotten to this point because we followed the science, and the people of Massachusetts did the hard work and made the sacrifices. We are now prepared and protected, and we can move forward together. Thank you. And with that, I'll turn it over to Lieutenant Governor, who will then turn it over to Secretary Sudders, who will then turn it over to Secretary Keneally. And I just want to say at this point how much I appreciate the days, nights, weekends, weekdays, basically every moment of every day that these three people have put into this effort. Thank you.
Good morning, and thank you, Governor. COVID has impacted every resident of our Commonwealth in one way or another, but we all know that there's been a significant impact also on our children. As the Governor said, the Commonwealth has made tremendous progress in the fight against COVID, which is allowing us to lift restrictions before the end of this month. That is welcome news to all of the people of our Commonwealth. Today, we are announcing updated guidance relative to our youth to relax mask requirements for many outdoor settings for our kids. These changes will take effect in advance of the May 29th general lifting of COVID rules that the Governor just announced. As an immediate step effective tomorrow, May 18th, the youth and amateur sports guidance will be updated to no longer require face coverings for youth athletes under 18 while playing outdoor sports. All youth and amateur sports restrictions will be lifted effective May 29th. But for youth sports, youth playing sports, tomorrow is the day that the face covering will be lifted. We are also updating guidance for K through 12 schools and early education providers. Effective May 18th, masks will no longer be required for outdoor activities like recess in these settings. DESE and EEC are also updating their guidance to allow for the sharing of objects in classrooms like toys and books. This guidance remains in effect beyond May 29th. We will also be releasing updated guidance for summer camps, which will be effective May 29th. Face coverings will not be required for outdoor activities. We are making these updates after consultation with our Medical Advisory Board to reflect the latest CDC guidance around outdoor face coverings and surface transmission while keeping our children safe. These vaccines are safe, effective, and are helping us get back to our new normal. Children 12 and older are now eligible for the vaccine and can sign up for appointments at any location offering the Pfizer vaccine. Go to mass.gov COVID vaccine. If you are our parent and have any questions about the vaccine and your child, please contact your pediatrician. Vaccines, as the governor noted, are widely available at more than 975 locations across our Commonwealth. Please make an appointment, or there are walk-up and pop-up opportunities to get your vaccine. We know that there are much brighter days upon us and ahead of us, and it's largely due to the access that people here have to the vaccine and that so many people have chosen to participate in the vaccination program. Before turning it over to Secretary Sudders, I want to say how grateful I am to the citizens of our Commonwealth, to all of the residents here for your hard work over the course of this past year. I want to thank the parents and everyone who has been part of this process as a fellow alum, how challenging this has been for our families and for our children. I also want to thank the business community. As the governor noted, restrictions and protocols and incorporating that into your business operations. We are so grateful to your sacrifices and your hard work, getting your employees to feel comfortable coming back to work and opening your establishments to the public for them to feel comfortable doing business with you. I also want to thank Mass Municipal Association and MAPC for hosting many calls for us to share information. You helped us do our jobs better. And I also want to thank our local boards of health for your partnership over the course of this past year. I do want to also thank the Reopening Advisory Board that we convened last April, and want to thank Secretary Keneally and his office for their leadership and hard work. May 18th of 2020 was the day that we came to this room and announced the first phase of our reopening plan. And here we are almost to the date a year later with a full reopening. It would not have happened without all of you working so hard along this course and along this journey. I want to thank Secretary Sudders and your command center for your extraordinary leadership, for your hard work and your dedication, always focused on keeping the people of our Commonwealth safe. Thank you. I'd now like to turn it over to Secretary Sudders.
Governor, Lieutenant Governor, Secretary Keneally, and good morning, everyone. Oops, sorry. As the governor indicated, on May 29th, the Commonwealth's face covering order will be rescinded as we adopt the Centers for Disease Control and Prevention guidance for both vaccinated and unvaccinated individuals. As a point of reference, April 20th, 2020 was the initial face covering advisory that we issued in the Commonwealth. There's been much progress over this last year. Additionally, in order to continue protecting some of our most vulnerable populations, effective May 29th, face coverings will continue to be required for both vaccinated and unvaccinated individuals at all times in the following locations: on public and private transportation, including on the MBTA, commuter rail, buses, ferries, and airplanes, and in ride shares, taxis, and livery vehicles. Face coverings are also required at all times in transportation hubs, including train stations, bus stops, and airports. The requirement applies to riders and employees. Inside K through 12 public schools, and is otherwise required by the Department of Elementary and Secondary Education. The requirement applies to students, teachers, and staff. Inside childcare programs, licensed and regulated by the Department of Early Education and Care, and is otherwise required by EEC. In healthcare facilities and healthcare provider offices, defined as healthcare facilities or providers licensed, certified, or operated by the Commonwealth, including nursing homes, rest homes, emergency medical services, hospitals, physician offices, urgent care settings, community health centers, vaccination programs, behavioral health clinics, and the Bureau of Substance and Addiction Services facilities. The requirement applies to patients, consumers, and staff. In 24/7 congregate care settings, including assisted living facilities, group homes, houses of corrections, Department of Correction prisons, jails, residential treatment programs, as well as shelters, in healthcare and rehabilitative day services and programs, such as adult day health, rehabilitation clubhouses, day treatment, recovery support centers, and center-based day support programs. These requirements apply to staff and consumers. Our best weapon against COVID is vaccination, as you've heard. They are effective, safe, and available. If you are not vaccinated, please get one to protect you, your loved ones, and our state. It is a selfless act and a life-saving one. Thank you. And with that, I will turn it over to Secretary Keneally.
Well, thank you, Governor, Lieutenant Governor, Secretary. Good morning, everybody. Well, here we are 1 year to the day when we announced our plans to reopen the Commonwealth's economy. I want to thank the 17 members of the Reopening Advisory Board for giving us a blueprint that followed the data and guided all that we've done over this last year. The Lieutenant Governor and I, and I'm always grateful that I got to co-chair this work with the LG, spent a lot of time with this amazing group over April and May of last year. Your collaboration with us was true public service, and we can't thank you enough. Since the beginning of this emergency, we've spoken from this podium many times about shared responsibility, and the people of this great state have responded in incredible ways to stop the spread and to keep our economy moving toward recovery. And our efforts together have now put us on the brink of a return to normal. I want to thank the businesses of the Commonwealth. With your customers and your workers front of mind, you persevered, you sacrificed, you kept people safe, and you got creative through 4 New England seasons and 2 virus surges. We have now reached a point in this fight where we can fully reopen and transition into the new normal. And I'm so excited and pleased about what this means for the diverse collection of small businesses that remain the lifeblood of our cities and towns. I also want to thank our residents who followed safety protocols and who have been patient with their favorite stores and restaurants as they did their best to strike a balance between serving their customers and keeping everybody safe. You have dined outdoors and ordered takeout, purchased gift cards, and made appointments when before you used to just walk in the door. And because of all of your support, these businesses are now seeing the other side of the pandemic and will be there for us going forward as we regain the lives we had before. We're announcing this reopening milestone 12 days in advance to give our small businesses and our communities time to plan for a return to normal and to make adjustments to their physical spaces and to modify their staffing levels. Kindness, understanding, and respect will go a long way in these coming weeks. Though masks and face coverings will, in most situations, be optional for those who are fully vaccinated, there will be business owners who will still choose to require them. That is okay. Just as many residents will continue to wear masks on a go-forward basis, some restaurants, stores, and venues will continue to ask you to do so at their place of business. Let's all pledge to respect each other's right to get back to normal at our own pace and in our own way. The last weekend in May historically kicks off the summer season. This year, let's use this time to get reacquainted with all that our state has to offer for dining, shopping, visiting, and staying. Our business owners will be so happy to see you. Thank you.
Questions?
Governor, why Memorial Day weekend? Why not a little earlier? We're doing so well. Some surrounding states are reopening much earlier.
Well, we had always talked about tracking our vaccine performance and our case counts and our hospitalizations. And there were a number of markers that we put down that all related to May 29th. And we felt rather than creating a series of steps between here and there, it would make more sense to focus everything around that date, since there was already a number of items that were taking place on the 29th to begin with. And frankly, we'll also get pretty close to our milestone of 4.1 million people fully vaccinated by that date.
Can you talk about what kind of a relief this was to come down here and say those words.
I think for everybody in Massachusetts, it's been a really, really, really long year. And I think the challenges and the tragedies that in many cases have accompanied everything associated with COVID have been really rough on people. And I have to repeat what all three of my colleagues up here said, which was the commitment that the people of Massachusetts made to this whole process, and especially to the vaccine rollout. I don't know if there are any other states that have a 99% return for that second dose that we have here in Massachusetts. People took the fact that the vaccine was a big part of our way out of this seriously, and that's a big part of why we're here today talking about this. And rather than relief, what I really feel is gratitude for the way that people in Massachusetts have responded to this.
Governor, judging by your tone, it almost sounds like this is a period at the end of the sentence. Is this over? I mean, are we done with COVID?
COVID's a little bit like, Michael Myers. I think what I would say is that we have made tremendous progress, and that's why we are able to do what we're doing here and what we're proposing here today. And when you have 3 out of every 4 adults basically on the verge of being fully vaccinated, and I assume we'll see similar performance out of our younger folks as they become eligible, and when more than or roughly 90% of everybody over the age of 75 is vaccinated, you're talking about a situation and a circumstance where we have really set the Commonwealth up, or the people of Massachusetts have set the Commonwealth up to be successful going forward from here. But obviously, this is something we're all going to have to continue to pay attention to, and we will.
Considering how successful this has all been, not only with COVID, but there's been no flu this year. Would you foresee, maybe not a mandate, but at least maybe on MBTA during the flu season in tight quarters, everybody wear a mask because it works?
Well, the CDC guidance is, I think, reflective of the fact that there are certain circumstances and situations where they believe it continues to be important for people to wear a mask. What I will say about masks generally is I have talked to a number of small business owner operators who basically think that wearing a mask, and in some cases their customers wearing a mask, has had a positive impact on the transmission of other kinds of things like flus and colds and that kind of stuff. And I would imagine some of them may just on their own decide that they'll continue to wear a mask, at least during that season as they go forward. But as both the Lieutenant Governor and I and as Secretary Keneally all said, businesses are going to make decisions about what they think makes the most sense for their employees and their customers, and we should all be respectful of that.
What about like on the MBTA? I mean, that's what the team coming down here, and it was busier than it's been. Everybody had a mask on, and then widely distanced, and I don't think anybody felt like there was a problem.
Well, we're certainly going to follow the guidance from the feds on that one at this point in time, and if they change their guidance, we'll obviously make our own decision at that point. But I support the decision that the CDC made on transit.
Governor, a lot of people are still wearing their masks outside. Do you guys have any feedback on why that is? Is it people are just cautious, or is it just a real hard habit to break? And then as we now cycle into this, don't have to wear inside, why do you think people are sticking to using the mask?
I think for everybody, one of the things about the CDC guidance is they basically said we've seen a series of studies that have demonstrated that people who are vaccinated, fully vaccinated, don't transmit, very unlikely to transmit the disease, very unlikely to get it. And I think that has a lot to do with their recommendation. But they also said that this is in some respect a question of personal responsibility. And I think for some people, there's a personal responsibility issue that's attached to this. And I understand that and appreciate it. I think for everybody, the way they come out of this is very much going to be sort of on their own terms. And I think we should all understand that.
And just to follow up, the staffing that Secretary really talked about, a lot of places are having trouble finding people to work. Any ideas on how to get places staffed up for them?
Well, I certainly think the fact that we're talking about where we believe we're going to be on vaccinations by the end of May and what that means we can do with respect to our economy generally is a big positive statement about the fact that Massachusetts is a much safer and smarter and better place than it was a year ago, and certainly better, safer, and better place than it was before this process started in December. And I hope that will encourage some folks who may be concerned about going back to work that it's safe and okay to do that.
What about children under 12 thoughts on how to keep that safe from variants or anything like that?
Well, certainly it's one of the reasons for keeping the guidance in place with respect to schools is to make sure that, schools are open, kids are there. We're doing pool testing every week. More than half the districts in Massachusetts are participating in that program, and the positive test rate is, I think, 0.83% or something. So there's a lot of good news there about the fact that there does not appear to be much transmission, certainly in school, and not a lot of COVID apparently, there anyway at this point in time. I think what I would say with regard to that is there are clinical trials going on for 2 to 11-year-olds. I don't know when those trials will be complete, but if the vaccine, which has turned out so far to work extremely well with every population that's been involved in, we'll certainly have a vaccine program for that community if the feds granted an emergency authorization.
Well, what about summer camps? The kids under 12 who go to summer camps, you don't know if because you've lifted the mask,
Outdoors,
outdoors. Only,
right.
Not indoors.
Not indoors, just
And so-
outdoors.
And will there be a way to tell if like counselors are vaccinated?
That's going to be up to the camps to make decisions about how they want to play that. And again, that's a good example of where the CDC guidance is pretty clear. If people are vaccinated, they're not going to spread it, except in very extreme circumstances, and they're not going to get it. And if a camp were to decide they want their folks to get vaccinated as a precaution for the summer, that's something they can do. And there's 975 places around the Commonwealth where people can get vaccinated.
So Governor, on that topic, what's your confidence in just sort of the honor system around that mask advisory and guidance that people who aren't vaccinated will really continue to wear their masks?
Well, I'll come back to the point that was made previously about the fact that people, for the most part, around Massachusetts are still, in many cases, wearing masks and doing so on their own. And I think the message from us is, if you're fully vaccinated, the data and the guidance from the CDC is pretty clear. You're very unlikely to transmit it. You're very unlikely to get COVID. If you're not vaccinated, you should get vaccinated for all the reasons we've talked about before, for yourself and for your family and for the safety of your friends and your neighbors. But if you're not vaccinated, you should wear a mask. I mean, that's indoors, right? The guidance on outdoors is pretty consistent, that's very unusual for transmission there.
Governor, do you get any feedback on international travel? I know you were waiting for the feds to figure out how they're going to do that. Did your trip help with that?
We have not heard much about international travel from the feds at this point in time. It's still something that's clearly sort of under review.
Governor, was this a close call at all on the indoor mask mandate? I know New Jersey, for instance, is keeping the mandate for public places like malls and stuff inside. A lot of people are uncomfortable walking around without a mask now. I know you said it's a personal choice. Was it a close call for you, or did you think about keeping it on for the inside?
Well, we talked a lot about a number of these issues and spent some time with our medical advisory board. But I think at the end of the day, when you start with 75% of your adult population most likely going to be fully vaccinated by the end of this month, the beginning of June, that's a heck of a lot of positive support for the idea that this is something where in certain circumstances, consistent with the CDC guidance, we believe people should be wearing masks. But beyond that, we're in a pretty good place.
What about communities that want to wait a little while?
The rules are always the same here, and communities that don't want to go as aggressively or as far as we're proposing to go here, they know the facts on the ground in their communities as well as are better than anybody, and they can make whatever decision they make sense, and we will support that.
A number of, if I recall correctly, there are a number of provisions for people making state emergency put in place, like electricity getting shut off, other utilities, and a lot of people just haven't caught up yet. Are any of those protections going to stay in place for people?
Well, once the emergency order is over, the emergency order is over, and we're actually spending some time. Probably one of the other reasons for the 2-week period here and leaving the order in place until June 15th is to figure out if there are things we need to work with our colleagues in the legislature to address that are sort of part of that basket of orders that aren't particularly related to the stuff that people pay the most attention to. So we're going to do a review of that and work with our colleagues in the legislature to deal with whatever is sort of undone by this.
It's fair for me to say that people don't need to panic, there may still be some protection in place for them if they got, I don't know, they have to pay their, everything to pay their electricity bill and finals.
Well, I'd say two things about that. The first is our eviction diversion program has actually worked pretty well here in the Commonwealth, and it just received a very significant boost financially from the federal government's program in the CARES Act 2, which basically provided about $475 million to support that initiative here in Massachusetts. And since we'd already built an infrastructure for it, unlike a lot of states where they still haven't quite figured out how to move the money and to get it out the door and deal with eligibility, we have all that stuff in place. And I think that will help a great deal with one of the biggest concerns a lot of people have.
Governor, do you think there'll be a day when we completely lose the masks in elderly care facilities, on the T, in schools?
I'm not going to speculate on that. What I will say is the surveillance testing, which we continue to do in long-term care facilities, and the gear and the rules that became part of the way those places operate over the course of the past year has had a profoundly positive impact on case counts, on hospitalizations and deaths associated with those institutions. And I think people have worked enormously hard to deal with COVID in those settings. That continues to be one of the areas where everybody needs to continue to focus. And I would be really cautious about doing much of anything on that unless I got a lot of really positive feedback from the experts that it was okay to move in a different direction. I mean, I think that is an area where people have really done a ton of work and put a lot of resources and rulemaking and guidance into place to support seniors and the folks who work in those institutions. And I would do nothing to screw that up.
First thing on your to-do list is non-COVID. I know you have a lot of background. Is there one major thing besides fixing all the COVID problems?
I think we're going to focus on that collection of work we need to do between now and the 29th. But it's definitely good news for Massachusetts.
So we're going to ask you about proof of vaccination. I know in New York, a friend of mine whipped out his phone, he's got an app with a QR code and proof you've been vaccinated. Do you think it's ever going to be important in this state that we be able to prove vaccination? Just carry a card around?
I've said all along that I think we want to follow the federal government's guidance on this one. I think it's really hard to do this on a state-to-state basis for a lot of reasons, especially given the amount of back and forth that goes on in the northeastern part of the U.S. I was on a call this morning with a bunch of governors from New England and the Northeast and the Eastern Canadian province premiers. We do this once a year, usually in the fall. And we talked a lot about how much commerce, we were talking mostly about commerce, but we talked about how much commerce goes back and forth across all the New England states, where people work, where they live, where they vacation. I mean, it's almost like one region. And to have all of us trying to come up with different rules or strategies around something like that would be enormously complicated. If the feds decide they want to move in that direction, that's something we'd certainly engage with them on. But I think state by state, especially around here, that's really complicated.
Thanks, everyone.
Thanks, everybody.